Hello, viewers. Welcome you all for yet another Health Talk series. I, Dr. Arya, am pleased to introduce today's speaker for the Health Talk series on World Blood Donor Day. Our esteemed guest is Dr. Suresh Babu, a research officer at JSS Institute of Naturopathy and Yogic Science. Dr. Suresh Babu brings over 13 years of dedicated experience in the field of yoga and naturopathy. He has completed his MD in yoga therapy and rehabilitation medicine. As a head of the Department of Community Medicine, he has been instrumental in leading various public health initiatives and research projects. His commitment to advancing medical knowledge and improving community health outcomes is truly commendable. His dedication to the field is evident through his numerous publications and his active participation in national and international health forums. We are honored to have you, sir. Please join me in welcoming him. Over to you, sir.
Morning, everyone. So I'm pleased to be present in this web series. So, World Blood Donor Day. I believe everybody are aware about blood donation and its importance. So every year we celebrate on June month for felicitating and promoting blood donation. So it's been like 20 years of World Blood Donor Day. It is about creating awareness for the altruistic activity of blood donation. So blood donation, when it say about blood donation, so why it is so important and how it became very significant. So blood donation is a meticulously orchestrated process rooted in the intricate science of human physiology. If you're donating an organ, it will not get generated, but if you're donating blood, it gets generated. And both the donor as well as the receiver can be healthy. Understanding the science behind the blood donation involves dwelling into the physiological processes that make the altruistic act not only possible, but also crucial for the well-being of individuals in need. So who are all in need? So starting from a very young age, from a toddler, newborn baby, till a very elderly, throughout the course of life, everybody needs to sustain healthily. So Blood Donor Day, so it is celebrated in June 14th, serves to raise awareness about the need for safe blood and blood products, and to thank voluntary and unpaid blood donors for their life-saving gift of blood. So what is so special about it? So it is an innate act of serving the society. It's part of a communal responsibility, like every citizen taking a responsibility of helping someone who they have not even met, who they have not even known. So this is about blood donation. So the day is recognized by WHO, World Health Organization, and its partners to highlight the importance of regular blood donation in ensuring that all individuals and communities have access to timely supplies of safe and quality assured and blood products. So for example, blood serums and all. So that is very, very essential for people who are in need. So, yeah. So the objectives of Blood Donor Day. So there are main objectives like to thank the blood donors, to recognize them, to appreciate the selfless contributions of blood donors. This is the first objective. Then the second one is to promote the community participation. So to encourage more people to become regular blood donor and motivate others in their community to donate blood. The third thing is to raise awareness. So to inform the public about the need for regular voluntary blood donations to ensure the quality, safety, and availability of blood and blood products for patients in need. And fourth one is mobilize support. To garner support for national blood transfusion services, blood donor organizations, and other non-governmental organizations involved in blood donation. So these are the four objectives of Blood Donor Day. So why blood is called as a lifesaver? Blood is a vital fluid, and it is something like a medium which transports oxygen, nutrients, and hormones to various organs and tissues and maintain health. So whenever the quantity or the viscosity of the blood changes, there will be some abnormality with respect to an individual's health. Blood is often related with the essence of life. It plays a pivotal role in sustaining human existence. As long as a person survives, lives, the blood will be in always in momentum. It never gets stagnated. It's overstated, making blood donation a critical and altruistic act that directly impacts the well-being of individuals and communities. So the scientific underpinning of blood donation lies in the principle of replenishing the essential resource to maintaining a healthy and functional circulatory system. Okay, so once you donate blood, so how does it going to help others? So blood donation. So in blood donation, evidence have said that blood donation will help both the donor as well as the recipient. So where does it donated blood goes? So it goes to medical treatments. It goes to people who are undergoing surgery. So or people who are having life-threatening conditions. So there this donated blood will be used. So normally a person will be having around 4.5 to 5 pint of blood in their body. And donating a minimal amount will not be harmful for their health. Okay. So importance of blood donation. So mainly it helps in saving lives. So we are seeing that most of the countries are in developing or in underdeveloped state. So there we can say that malnourishment, poor health status. So that will generally we can see it with severe anemia, poor treatments, poor surgeries, poor healthcare, underweight children, and during childbirth they need it. So in order to save the population, this blood, what has been donated, it will be very, very crucial. And similarly with emergency preparedness, for example, on a daily basis, we are seeing a lot of emergency, starting from national disasters, road traffic accidents, industrial accidents. So for that, there will be always a constant need of emergency preparedness. So whatever blood which has been stored, whatever serum has been donated, so that will be stored and it will be used for such emergency. And support for healthcare services. So healthcare services, generally what we are trying to say is hospitals and clinics, where there will be a general need where there is a need actually. So every day we are seeing that there is a lot of deliveries when it comes to pregnant women. So there will be a need of blood and there will be a constant surgeries, organ transplant operations. So there will be a need of such stored blood. So blood donation in India. So India, which having nearly around 1 billion people alive and functioning. And what is the number required when it comes to blood donation is 14.6 million units of blood is required for active healthcare. But what happens is we don't meet the necessary. And similarly, most of the blood donation is being done by majority of youth as well as women. So starting from 2008 to 2018, there is a 10.7 million donations from voluntary unpaid donors when it comes to India itself. So in India, the knowledge and awareness regarding the blood donation has been improved in the last 10 years, especially within the span of 2008 to 2018. So it is just before COVID pandemic, okay? So after that, a lot of changes have happened. So blood donation and circulatory dynamics. So circulatory dynamics means we generally speak about transporting oxygen, nutrients, hormones, and vital substances throughout the body. And when you're donating blood, the maximum we are donating is 500 milliliters to a liter of blood we are donating. So this donation will generally help with many factors. For example, it will help with your blood viscosity, immunity, and it will help you in balancing your blood volume and excess of iron. So many things it will look into. We will look into every aspect in detail. So volume and fluid dynamics. So blood volume, like I said, 4.5 to 5 liters of blood are present. But this blood, when you're donating blood, what happens? The blood volume decreases, the blood viscosity decreases, and thereby what happens? The pressure exerted on the arteries is also reduced. And it will help in the release of nitrous oxide, and thereby it again brings a body in a rejuvenating cycle. So this rejuvenation cycle will prevent a person from getting cardiovascular disorders. It will, it will help them to maintain their normal heart rate rhythm, their stroke volume, their heart health. And this blood vessel based disorders are generally being protected from. So benefits of blood donation, benefits of blood donation. So when it comes to that, so it helps lower blood pressure, reduce the risk of heart disease, boosts the immune system, help with weight loss, gives donors a sense of satisfaction and fulfillment. So how does it help with lowering blood donation? It's not changing. Yeah. Excuse me. So volume reduction and regulation of blood fluid balance and hormonal response and improved arterial function. Okay. So volume reduction, blood donation involves removal of a specific volume of blood from the donor. This thereby will reduce the blood volume, leads in subsequent decrease in overall blood pressure. Next thing is a regulation of fluid balance. So when it comes to circulation, it's not only just heart. We can say with respect to the kidneys also. So the blood goes to constant filtration and fluid retention. And this water retention happens with respect to both your intestine as well as with your kidneys. So this involves the movement of water from tissues into bloodstream, aiding in maintaining the blood pressure within a normal range. Then comes hormonal response. Blood donation triggers the release of certain hormones such as vasopressin and aldosterone, which plays a role in regulating blood volume and blood pressure. This hormonal adjustments contribute to the overall decrease in blood pressure. So this is a mechanism with which a person can maintain the blood pressure just by donating blood regularly. And improved arterial function. If there is a change in the blood volume, what generally happens? The pressure exerted on the arterial wall by the blood is decreased. And next thing is the removal of excessive iron due to blood donation may positively impact blood vessel health, because the viscosity of the blood is related with the HV, the hemoglobin, the iron content. So once it has been relieved, the blood volume as well as the viscosity is changed. Thereby what happens? The arterial walls pressure also gets reduced. So promoting better elasticity and reducing the resistance, which can contribute to lower blood pressure. So this is the mechanism. So stimulation of renin-angiotensin and aldosterone. And next thing is increased nitric oxide production. Blood donation leads to an increase in the production of nitric oxide molecule that helps to relax the blood vessels. This relaxation of blood vessels can contribute to the lowering of blood pressure. Blood donation and heart disease risk. So when it comes to heart disease risk, generally what we understand is heart disease risk means maintaining proper blood pressure. So heart disease risk can be reduced by decrease of the blood viscosity, lowering cholesterol levels, improving the vascular function, and reducing the inflammation. So all this four can be done just by donating blood regularly. So blood donation helps in lowering LDL and further reducing the risk of heart disease. And next important thing is, so increasing the vascular functions. So when there is change in the pressure in the blood vessels, the wall of the blood vessels, that will itself, it will have a positive impact on prevention of conditions like atherosclerosis and systolic hypertension. So blood donation and immune system. So blood donation generally stimulates the production of new blood cells. So blood consists of both RBCs and WBCs and platelet cells. And when you're donating blood, it's not only we are donating the blood, we are also donating the WBC, the platelets, the plasma, and RBCs. Thereby, that will also get replenished. So it is also in a constant cycle of regular blood donation will help enhance the immune system function. Donation helps maintain healthy levels of blood components. So blood donation and weight loss. So if a person is trying to do weight loss, a blood donation is a good activity in helping them to lose their weight. So blood donation is helpful with calorie expenditure also. So if you are trying to spend calories, so when you're donating blood, nearly 650 calories of blood is also being donated. So it's actually a passive way of reducing your calories or reducing your weight. And similarly, the blood donation in iron stores. So generally, blood donation is not recommended for anemic person. So we will look into who can donate and how to donate blood and all. But when it comes to blood donation and iron stores, excess of iron storage in the body, iron is not stored in the body, but the excess of it will be also gets passed on to the recipient. So blood donation as a lifestyle catalyst. So lifestyle catalyst means what? It is a method of promoting a healthy activity. Okay. Positive benefits of blood donation, anti-inflammatory effects. So it reduces the inflammatory markers like IL-6, TNF-alpha, IL-7. So interleukin levels is constantly maintained when it comes to this blood donation. Then second thing is stimulation of hematopoiesis. Hematopoiesis is production of blood cells. So blood donation will encourage and improve the bone marrow in producing blood cells. And erythropoietic boost happens because RBC, when it's been donated, has to be replenished. And again, this helps in the erythropoiesis process. Erythropoiesis means production of red blood cells. So how it is going to help when it comes to RBC? RBC is a vital thing when it comes to the health. So it carries oxygen, it circulates oxygen throughout the body. So it goes to the nook and corner from our basic arteries through arterioles and getting it circulated throughout the bodies. Goes to the ECF, it goes to the ICF, it circulates. And where it is getting it, the oxygen circulated, it circulates to the cells. So the cells receive proper oxygen and thereby proper cell function happens, the cell sustains. So this blood donation, how it is going to help with the regular health? What is it? Regular health. So blood donation generally helps with blood pressure regulation. Okay. So yeah, thank you. So blood pressure is something a constant danger when it comes to non-communicable disease. So what is with blood pressure and its regulation? So we are facing a very constant thing, like 1 in every 8 person in India is suffering from hypertension. 1 in every 7% suffering from diabetes mellitus. 1 in every 5 suffering from your arthritis. So anemia very constant with women population in reproductive health. So when it comes to this blood, it is a prime element with all these 3 non-communicable diseases. So blood pressure is something which is elevated blood pressure seen with systolic hypertension. So we can just maintain this blood pressure just by blood donation. So it has a good impact upon arterial circulation as well as with hormonal regulation. So signs of blood donation and cardiac health. So Journal of American Medical Association have said that regular blood donors had a lower incidence of hypertension compared to their non-donors. So this is the science which says that regular who are giving blood donation, so they have a very less incidence of hypertension compared to non-blood donation. And second thing is men who donate blood regularly had a reduced risk of developing high blood pressure compared to those who did not donate. So this is published by American Journal of Epidemiology, a part of community medicine. And third thing is blood donation influence blood pressure, highlighting the role of decreased blood viscosity and reduced oxidative stress. So this is published in Circulation Research. So regular blood donation has been associated with reduction in blood viscosity and endothelial function. So oxidative stress generally has an impact upon their endothelial function. So if the oxidative stress is higher, what happens? The resistance happens in the arterial walls. So thereby what happens? Impaired vascular function. Again, it will increase the blood pressure. So when you are donating blood, so this pressure exerted on the arterial walls as well as the endothelial cells reduces. So that is a very, very important impact on the endothelial function when it comes to blood donation. So notable NGOs in India which promotes this blood donation. So one and very prime one is Indian Red Cross Society. Before the independence itself, the Indian Red Cross Society is active in blood donation. So they encourage the blood donation camps, runs blood banks across the country. So most of the government hospitals are very much associated with Indian Red Cross Society, as well as student associations like NSS, national level activity of NSS is closely related with Indian Red Cross Society. Then comes Blood Connect Foundation. This Blood Connect Foundation is a training one, which is with Youth Federation of India, as well as it actively involves with youth engagement and technological solutions. And third thing is Think Foundation. So these are main thing. Then Friends to Support is something which is of recent origin, and other NGOs like Rotary Blood Bank. So they are all well connected with either government as well as private hospitals and other institutions. So they mainly focus on receiving the blood donation and supplying the donated blood to the blood banks. So who can donate blood? So generally healthy individuals can donate blood. And people within the age range of 18 to 60 are fit to donate blood. So what is the frequency of donation? So men can donate blood for every 12 weeks and women can donate blood for every 16 weeks. So 12 weeks means once in 3 months, men can donate, and once in 4 months, women can donate. So men can donate like 4 times per year, and women can donate like 3 times per year. So steps in blood donation. The first of all, I think is you have to register and identify yourself as a blood donor and do a health check and screen. So whether you are healthy, whether you are having any complication. So whenever you are registering, the government takes a step in seeing that you are healthy. So whether they are healthy or not. And next thing is interview and medical history. So donors generally do a one-on-one interview with health professionals, and they can check with their health status. So next thing, before donating blood. So that is with the registry. What is the previous step? Then next thing is before donating blood. So before donating blood, you have to see whether your hemoglobin is in the normal range. If it is above 13 or around 14 or 15, so that is to be assessed first. Then once it has been assessed, then donation process will be done. So donation process means a day where you are feeling healthy, you are feeling energetic, where you have been not intoxicated for last 48 hours, where you're not in any medication for any systemic disease. So especially when you're in blood thinners and all, you are supposed to be not donate blood when you're on the donation day. So next thing is post-donation refreshment. So once you donate blood, so very important thing is, so it's very common to see that when you're donating blood, they'll give you a packet of biscuit and electrolyte. So that is a refreshments just after giving blood. Because when you're donating blood, what happens? Your blood glucose level, it's getting cut. The next thing is your electrolyte level also gets depleted. Not depleted, it gets reduced. So at that time, it has to be properly replenished. So that has to be provided after donating blood. That's called as post-donation refreshments. Then comes observation and post-donation guidelines. So immediately after donating blood, what generally people feel is they feel little weaker. A sign of little tiredness after that. So they have to be observed. So immediately after blood donation, you're supposed to not do anything little strenuous. You have to drink a lot of fluids. Make sure that the body gets hydrated. So that is very, very important. Then record keeping. So once you have donated blood, you have to record that you have donated blood at that particular day. So that's very, very important. See, so like I said, men can donate like every 12 weeks and women can every 16 weeks. So in order to maintain the health status of both the donor and the recipient, you have to keep proper records. This information is critical for maintaining a safe and efficient blood supply. So what is it with the blood supply itself? So if you are donating blood, the health of the donor and the quality of blood being served or donated, it's very, very important. Then the follow-up and communication. So follow-up and communication is, so if you are donated blood, the donors receive a follow-up communication. So to express the gratitude of being serving for the society, for contributing and providing information on when they're eligible to donate again. So that is the last step. So when it comes to this, the key thing is registration and screening. Donors need to register and provide basic information. And screening involves health questionnaire and a mini physical check. So for example, they'll be seeing for active, so pulse rate, blood pressure. So these are some active things generally they see when you're going for blood donation. The next thing is hemoglobin check. Prior to donating blood, it is vital that you generally check your hemoglobin. A small blood sample is taken to ensure the blood donor has adequate hemoglobin levels. And donation process, the active donation process hardly takes 8 to 10 minutes. The specific volume of blood is collected usually around 500 ml, not more than that. So post-donation refreshments, after donation, donors are provided with refreshments rich with calories and electrolytes. So observation guidelines, so symptom recognition, monitoring vital signs, then rest area access, and immediate post-donation. So here we have to see that after donation, we have to see for your blood pressure, your pulse rate, it has to be monitored. Okay, it is not just like any other activity because blood volume is like giving the life itself. Okay, and one mistake people generally do is they say that once you donate blood, you will go sick. No, actually, we don't go sick. It's a healthy way of reducing the aging process. We are restarting the system like erythropoiesis, hematopoiesis, and we are boosting the bone marrow to function properly. So that's very, very important for healthy living. And post-donation guidelines, monitoring health, and dietary recommendation. Nowadays, people are not being properly educated when it comes to diet. So we are supposed to take diet which is rich in iron, which is rich in vitamins, which will help us to generate blood. But what happens is the wrong education. I do blood donation, but I don't focus on this vitamin-rich foods, the iron-rich foods. So that has to be taken care. And Sterner's activity. So Sterner's activity, everybody can do Sterner's activity as part of healthy living. But Sterner's means what? So where you exert yourself is called as Sterner's. When you're doing blood donation, you have to make sure that if you're donating blood for 2 consecutive days, or at least the day you are donating or the next consecutive day, you're not supposed to do Sterner's activity. Then last but not least, hydration. There is hydration principle which says that we have to consume at least a liter of water for every 15 kg of your body weight. So that we generally ignore for healthy living itself. But when you're donating blood and all, we have to very be specific about hydrating yourself. So if a person is 60 kg of weight, a person is supposed to take nearly 4 liters of water itself, apart from the milk or whatever other source of water they are consuming. They are supposed to take water as it is of 4 liters. And this is very important when it comes to blood donation. And it's part of the guidelines itself about hydrating. So last but not least, so be a volunteer and Udiram Kodupom, Uirai Kapom. Thank you all.
Thank you, sir. I, Dr. Arya, would like to extend my heartfelt gratitude to Dr. Suresh Babu, sir, for delivering such an insightful and inspiring talk on World Blood Donor Day. This gave us a deeper understanding of the importance of blood donation, sir. Your contribution to this Health Talk series is greatly appreciated, and we are grateful for the time and effort you have put into making this event a success. Thank you, sir, for sharing your wisdom and experience with us today. To all our viewers, thank you for joining us. Stay tuned for the next upcoming Health Talk series, where we will continue to bring you valuable insights from leading experts. Thank you.